What are the different types of braces and which one is best for me? There are several types of braces available to straighten teeth and correct bite problems, each with its own benefit and drawbacks. The best type of braces for you will depend on your individual needs and preferences. Some common types of braces include metal braces. Traditional metal braces are the most common type of brace and are made of metal brackets and wires. They are highly effective in correcting a wide range of orthodontic problems, but can be noticeable and can cause some discomfort. Ceramic braces. Ceramic braces are similar to metal braces, but they are made of clear or tooth-colored materials and are less noticeable. They are more fragile than metal braces and can be more expensive. Good. Lingual braces. These are similar to metal braces, but they are placed on the inside of the teeth. So because they are on the tongue side of your teeth, you can't see them. The people that are looking from the outside can't see that you've got braces on, but that makes them hard to clean because they're behind your teeth. And it also means that only certain orthodontists that are skilled in this can offer it. So it's not something that every orthodontist or dentist can offer, these lingual braces. They're very specialist. Invisalign is a clear removable plastic aligner that is custom made to fit over your teeth. It is virtually invisible and can be removed for eating and brushing. However, it may not be suitable for more complex orthodontic problems. So Invisalign is a popular option and more people are getting to know about it. I use it on my patients and the capabilities of what the aligners can do has been growing as the technology has advanced, but it does require the experience and skill of your dentist or orthodontist to achieve great results. And there might be certain limitations to certain movements that you can do with aligners. But at the stage aligners are at now, a lot can be done to treat even more complex bites and malocclusions. Self-ligating braces are similar to metal braces, but they use a special clip instead of elastic bands to hold the wire in place. This makes them more comfortable and requires fewer adjustments, but they can be more expensive than other types of braces. It's important to consult with your orthodontist to determine which type of braces is best for you based on your specific needs and goals. They can perform an examination, take x-rays, and provide you with a personalized treatment plan to help you achieve a healthy and beautiful smile. So some very good points there by ChatGPT. And that raises the question of people that are taking more of a DIY approach at straightening teeth. Let's see what ChatGPT has to say about this. Should I use a DIY approach to getting my teeth straightened? ChatGPT says, I would not recommend using a DIY approach to straightening your teeth. Orthodontic treatment involves making precise changes to the position and alignment of your teeth and jaws and requires specialized training and expertise to perform correctly. DIY orthodontic treatments such as the over-the-counter aligners or at-home teeth straightening kits may seem like an attractive option because they're often less expensive than professional orthodontic treatments. However, they are not recommended for several reasons. So lack of customization. So DIY orthodontic treatments are not custom made to fit your specific dental needs and may not provide adequate correction for your particular orthodontic problem. Where I see this as the case, it might be that the center of your face and the center of your teeth isn't quite matching up. So it might be that you're getting straighter teeth with a DIY approach, but your center line is being shifted way away from your center line. So things like that are not going to be easily picked up by having a DIY approach. Whereas a dentist or an orthodontist who actually assesses you can make sure that your center lines are matching up or are not going away from where we want them to be. So again, you want a process where the treatment is customized and personalized to you. Increased risk of injury. So DIY orthodontic treatments can put excessive force on your teeth and jaws, potentially causing damage or harm. One of the things that we know with moving teeth is that the roots can shorten. So we want to first make sure that you do have good root lengths to be able to undergo orthodontic treatment. And then the rate at which your teeth move, how quickly they're moving through the bone, that has to be controlled to make sure that we are not damaging your teeth for the long term. And again, this is why it's really important to have a clinician overseeing the treatment rather than a DIY approach, because you don't know what you don't know. You may be harming your teeth for the long term by doing it yourself. Inadequate monitoring and adjustments. So with the DIY approach, you will not have the benefit of regular checkups and adjustments from a trained orthodontist, which can lead to suboptimal results and longer treatment times. Yes. Inadequate hygiene. DIY orthodontic treatments may not be cleaned and disinfected properly, increasing the risk of oral health problems. Limited support. If you encounter problems with the DIY orthodontic treatment, you may not have access to the support and expertise you need to address them. In conclusion, orthodontic treatment is best performed by a licensed and experienced orthodontist. By seeking professional treatment, you can ensure that your teeth are straightened safely, effectively, and efficiently, and that you achieve the best possible results. So having a trained professional overseeing the process is something that I definitely agree with.